Acetylsalicylic acid, aka aspirin, is best known to be developed under German pharmaceutical company Bayer in the late 19th century. It is made by adding acetic anhydride to salicylic acid. Today, this oral drug is widely used for its many therapeutic properties, including analgesia, meaning the relief of pain, antipyretic properties, or fever relief, anti-inflammatory properties, and headache relief. Because of these properties, it is one of the most widely used drugs in the world, with an estimated 40,000 tons of it consumed annually. However, it is most commonly used in the prevention of heart attacks and strokes caused by thrombosis.
But I did start taking baby aspirin to reduce my risk for heart attack.
That makes sense. Gotta keep an eye on it, you know.
You really do.
You gotta knock off the sweets.
Thank you.
Thrombosis is the production of a blood clot that forms in blood vessels and can ultimately lead to the disruption of blood flow to a tissue or organ. Thrombosis can occur under certain conditions due to the effects of platelets and fibrin within the blood. Aspirin inhibits platelet aggregation by reversibly inhibiting an enzyme called cyclooxygenase 1, or COX-1 for short. It does this by adding an acetyl group to its structure. COX-1 is responsible for the synthesis of prostaglandins, which are hormones involved in the transmission of pain, inflammation, and control of body temperature. Inhibition of prostaglandin production leads to analgesic, antipyretic, and anti-inflammatory effects. Aspirin is a part of a class of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs, which all have a similar mechanism of action. A specific prostaglandin, prostaglandin H2, is the precursor of thromboxane A2, which is a molecule responsible for inducing platelet aggregation. Thus, the inhibition of COX-1 leads to a decrease in prostaglandin production, which leads to a decreased production of thromboxane A2 and prevents the further production of blood clots.
I don't know you anymore. Aspirin. You're breaking my stomach lining.
Stomach produces acid that aids in the digestion of food. Protecting itself from the corrosive effects of this acid are bicarbonate, which helps neutralize the stomach acid, a constant blood flow to the stomach lining, which aids in cell repair and renewal, and a mucus layer that coats the lining. This lining is produced by the cells of the lining itself. Aspirin travels to the stomach lining via the circulatory system, and again inhibits cyclooxygenase 1. The enzyme here, through the effect of prostaglandins, enhances blood flow to the stomach lining, which promotes the production of protective mucus. Inhibiting this enzyme results in a decreased production of this mucus, leading to an unprotected stomach lining. An unprotected stomach lining can result in the development of ulcers. These peptic ulcers can lead to the increased risk of gastrointestinal bleeding. Other adverse side effects of taking aspirin can include hives and swelling, angioedema, increased bleeding times, and in some rare instances, Ray's syndrome.
You were the chosen one! You were my brother!
Aspirin!
I loved you!
Due to these side effects, a number of factors need to be considered before prescribing aspirin as cardioprotective therapy. With all these factors, one must ensure that the benefit of the therapeutic properties outweigh any risk of serious adverse reactions. If you have a bleeding or clotting disorder, an aspirin allergy, or peptic ulcer disease, you may experience serious adverse side effects when using this drug. If you have a family history of myocardial infarction and other cardiovascular diseases, dyslipidemia, or albuminuria, you may need to take aspirin at some point. Aspirin use is recommended for males over the age of 50 and females over the age of 60 that have a major risk factor for cardiovascular disease. Aspirin may interact with other drugs which can alter its effects within the body. Ibuprofen, another example of an NSAID, can compete for the active site of COX-1. This can cause a decrease in the cardioprotective effects that aspirin offers. Aspirin can also be beneficial for diabetics with a history of cardiovascular disease. However, it should not be prescribed in diabetics that don't, as the adverse side effects may outweigh the therapeutic effects. Modifiable risk factors, including weight, alcohol consumption, smoking, and diet, should also be taken into consideration before prescribing aspirin. A change in lifestyle may have a more beneficial effect. Aspirin!
Aspirin.